I'm excited to be here with you guys to share with you what I've been doing here in the United States for the last 20 years with lasers. And that's creating peak performance, both with athletes to enhance their injury recovery and with everyday people, enhancing brain function, enhancing work activities, sports activities, everything that they're doing. The reason why I start off with this Star Trek kind of slide here at the start is because we're really going into the future of healthcare. This is the 21st century model and beyond of utilizing these high energy, non-thermal wavelength lasers. And that's a key point because a lot of people are aware of high power, which is dosage lasers that have low energy, which are like infrared lasers. And I'm not saying that to knock them. It's just they work very differently than what we're going to talk about are very high energy wavelength lasers. For example, we're going to come over here to this one. What I like to do is I like to say that I'm going to turn you into a laser Jedi master, like in Star Trek. I want you to be able to utilize these lasers to their fullest extent. And we look at these handheld lasers, I call them like my lightsabers. So we have my GVL, my green and violet one here, which is pretty small, but packs a mighty wallop. We look at the energy for each of these wavelengths. This is an important concept for you to understand as we talk about the techniques we're going to use in this webinar. Violet has the highest energy of any laser that's out there. The second highest is green. That has 2.4 electron volts. Violet is 3.1, and red is 1.9 electron volts. Now, why is that important? The reason that's important is, let's say you want to get a suntan, and you have two choices. You can go into a UV tanning bed or into an infrared sauna. The UV tanning bed is the only one that can give you a suntan because that specific wavelength has the right amount of energy and the right signal to cause a cascade, to cause you to make melanin for a suntan. And that can also cause you to make vitamin D to make your bones stronger and support your immune system. On the other hand, an infrared sauna might be great for muscle relaxation and detoxification, but no matter how much you turn up the power, you will never get the same kind of reaction that you do with ultraviolet to produce a suntan or vitamin D. So as we go through this webinar, I want you to understand that there are unique wavelength specific effects that you get with green, violet, and red, and I'll show you ways to combine those as well. Now, the other great way of utilizing lasers, apologies, I got a little cough from doing yard work, is when we utilize all what I call from Star Wars, my droid, which is the FX405. And if you come out to the live event that we're going to have in Australia, I'm going to be doing hands-on demos where you're going to get into workshops, and we're going to work through a lot of techniques. But I'm going to give you a good overview today. The great thing about the FX405 is you can actually spread it out over a patient or an athlete's body to enhance ATP, energy production, to decrease inflammation, to improve blood flow. And think about it, how many different things occurring in the body can get improved if you improve blood flow, you decrease inflammation, and you support mitochondrial function. There are a lot. So you get global benefits on here, even though we're talking about sports performance and injury recovery. There's a lot of different nuances you can do. So what I want to share with you first is this. This is a doctor who first heard me talking about utilizing lasers on the brain back in 2017, Dr. Michael Trayford at Apex Brain Centers down in South Carolina. And what's really cool is that Dr. Trayford is using these lasers not just for patients with injuries or neurodegeneration, but to also enhance athletic performance. So this is a U.S. Olympian, Manteo Mitchell, who did brain training in preparation for the Winter Games. And there you can see he's got the FX405 on his head with the red diodes, and then the GVL, the green, violet, the handheld one here on the brain as well to enhance the way the brain is functioning. What I want to show you this is it's not very complicated what you need to do in order to enhance an athlete's performance. Manteo, what he would do is he would use the GVL, the green violet laser, and the FX405 on his brain to enhance speed and sports performance. So those are some of your outcomes assessments. Is you can ask an athlete if they're in track, hey, track your time. You should be able to see that your time is getting faster as you use the laser on the brain. If they're like a baseball player and they're a pitcher, you should be able to see a faster velocity. If it's a rugby player, you know, they're feeling more powerful when they're running. Those are outcomes you can use. A basic protocol to make it really, really simple. And you can do this whether it's the FX or the green and violet, the red and violet, or the red. You're basically going to use the same protocols. Just the difference is you get the biggest bang when you utilize all three laser wavelengths, the red, green, and the violet. Now, with that being said, I started my practice 20 years ago with just one wavelength laser, just red. In 2008, I added violet, and in 2018, I started doing the research on the green and violet lasers. So we just see these bigger bangs for your buck when you have multiple wavelengths. So what you can do for the brain is you can use these frequencies, 1, 10, 40, and 60. Those are basic catch-all brain frequencies for anything you want to enhance. If you want to enhance sports performance, if you want to enhance a kid with a reading disability, or before you're taking a test, you want to do better, or at the start of your day before going into the office. I use that pulse frequency to support my brain as I get ready for the day, or when I'm going to do a webinar like this or a live seminar. Time frame is going to vary. It's going to be, I usually do at least 5 minutes. Some people might do better with 20. This is where you're going to use your expertise as a doctor, because there are no, one size fits all kind of parameters here. This is where you can play with it to see what fits your office flow and try to get the shortest amount of time that gives them the best result. So I'll start with somewhere between 5 to 10 minutes usually. If they get a great result and they're feeling like they're performing better, cool, we stick with that. My 20-minute times are usually reserved for people who have like autoimmune conditions, who have brain fog, who have things like Hashimoto's or neurodegeneration. I might go longer on that. And we'll charge more for that too. One of the other things I mentioned about the FX that's really neat is you can put one diode on the head, another diode on the trunk, and another one on the leg, so you can spread that dosage out. Now, one of my favorite things to do with athletes is to stack this with other activities. So, for example, as you see in this picture here with Mateo, he's up on a vibration plate and he's doing balance exercises. Now, I like to do that while the laser is also applied. And as you can see in this video here, I'm not going to have any sound playing out, but I just want you to see the video here. This is something you can share with your patients too. If you just do a search on Asheville, North Carolina, Mateo Mitchell, and laser, and it'll pop up here. This is where they're showing how when he's in this office, they have him doing things like they'll do eye exercises. Now you can do this old fashioned where you're just having someone do gaze, or you're doing where they're trying to accommodate convergence here. And you can also do peripheral stimulation, or like they're doing with Mateo, they have them up and doing things with apps. So there are apps you can download for an iPad, like different vision training apps, and you can do that. Or you can do these balance exercises, or a sports specific exercise, like a throwing motion while you laser, like a batting motion while you laser. So these are really simple things you can do. If you come out to the live webinar, the live event in May, we're actually going to get into groups. I'm going to show you some more advanced techniques where you can do some muscle testing while testing different nerve pathways and utilize the laser to strengthen these particular pathways. It's just a little too much for one webinar here. I want to give you an overview here. So the big takeaway here, the easiest way to enhance performance is you place the lasers on the brain, you have them perform eye exercises, balance exercises, or coordinated movements. Target time is 5 to 20 minutes. Settings can be 1, 10, 40, and 60. You can also add in 4, 9, 33, and 60, or 9, 16, 42, and 53. You can do any of those ones. Please understand, when it comes to the pulse frequencies, they are not set in stone. You can even switch them up from visit to visit and see what your patient seems to feel does more for them. Now, the question everybody has now is, well, why would you put a laser on the brain and what does it do? So here, if you understand nothing more than this slide, this will give you a great idea of what your lasers can do, especially think of all your patients coming in who are in sports where concussions are a risk, or they've been in car accidents or falls. So as soon as that laser is on the patient's brain, one of the things that's going to happen is you're going to get improved blood flow. That's going to start to happen very quickly. So if I take this laser and I put it on my brain like this, or shine it into the open mouth, I love doing it that way. Or let's say we hit over the carotid arteries. The blood vessels are going to pick up the laser energy and deliver it into the brain, which is really cool. This is why I like to activate, like with an athlete, activate what they're going to do at the same time, because then those neuronal pools will fire in that area of the brain. They're going to draw blood to the area. The circulatory system just picked up this energy here and will deliver it to that targeted tissue to get it to enhance their performance for an athlete, or if you have someone recovering from a stroke. You get that increased blood flow. You support lymphatic drainage, or what we now call glymphatic drainage. You decrease edema. Cool thing here is you stimulate angiogenesis, so you actually make new blood vessels. You're going to decrease neuron excitotoxicity, such as with glutamate. And the nice thing here over on the right is you're going to stimulate neuron progenitor cells, synaptogenesis, and neurotrophins like brain-derived neurotrophic factor. So we now know that lasering the brain can actually trigger the formation of new functional neurons in the brain too, and functional synapses. And then you get antioxidants in there as well. So these are all really great things to do. And let's say if you're working with kids, this is a study that Erconia did on kids with autism. And the reason I show this here is this is showing functional MRIs on what happens to the brain when treated with the Erconia laser. And this is a 5-minute sequence. top is before laser, bottom is after laser. So with these kids with autism, you see the red areas indicate increased blood flow and neuronal activity. And on the bottom slides, after just 5 minutes of lasering, you see changes on there. The reason why I show you that is because some people will say, oh, if you use blue or green or red, that's not going to penetrate deep enough into the brain to make any kind of a difference. You need to get infrared to go deeper. Here we're showing you that that's not the case, that we're actually able to go deep to the brain to change blood flow and neuronal activity with a red laser, and we've shown it with green and also with violet. And this is showing you with violet. This is taking the violet and just lasering over the vagus nerve, showing that by lasering here, it changed on QEEG what's going on in the brain. So think about it. When you're looking at an athlete for performance, one of the biggest things for function is their brain function. And here in the United States, these are some of our top concussion rates. And it's not just boys sports. We see girls soccer is one of the leading causes of concussions here. Then you got things like ice hockey, lacrosse, girls basketball, cheerleading, rugby is another one that's up there. All these things can trigger concussions. When an athlete has a concussion, to keep them performing well, you need to get a laser on them as soon as possible. Otherwise, those glial cells, the immune cells in the brain, will start to attack healthy tissue, and you can start to have problems over a long time, such as this guy, Jeremy Giambi. He played professional baseball in the United States and was a World Series champion with the Oakland Athletics. I played against him in high school in football. He's a great athlete. A lot of concussions over the years. As a retired pro, he's playing in a pickup game, gets hit in the head with a baseball, and 6 months later, he commits suicide. Now, it wasn't that final hit that did it. It was all the years of the hits without anything to correct the problem, without any laser on there. We're seeing this now. This is another professional football player in the United States with who chronic traumatic encephalopathy of multiple concussions that were never treated. He ended up killing 6 people and then himself. And we see also in the UK and Australia that there are players with early onset dementia who are issuing proceedings against rugby authorities. And I had the honor of being on a Zoom call with one of the leading scorers of all time for the UK rugby team. And we were discussing this problem that they're having with guys from repeated concussions starting to show these dementia signs in their 30s and their 40s. So there's a lot you can do with just having these patients come in regularly for brain treatments, either with a handheld or with an FX or a combination of them. And if you do this while they're playing, you're going to enhance their play and also protect their brain. So let me give you an example with a patient of mine where I did this on a runner who was coming in for something completely unrelated to sports. He was coming in for acne, and the violet laser has an FDA clearance for that. So we're using it on his face. And I told him, hey, listen, as you're using this on your face for the acne, I want you to pay attention to your 400-meter time, because I anticipate you'll probably see it get better within the next couple of weeks. He got all excited. He's a high school athlete. And he said, oh, that'd be wonderful. I'm already the top runner for my team, but if I can get even faster, that'd be great. So he came in about 3 times a week for that treatment for the next few weeks. I asked him a few weeks later, hey, how's your 400-meter time? He said, you're not going to believe it. I've shaved almost 3 inches off, which for those of you familiar with track, that's a huge time to shave off when someone's already fast. It was so fast that his coach came up to him and asked him, hey, what are you doing? Are you doing performance enhancing drugs? Because this is crazy how much faster you're getting. So you can get these results just by lasering the brain. When I do this on athletes who play sports like soccer, they say they can see the field better. On baseball players, the batters say they can see the ball coming at them and it looks like it's coming slower, and they can see the rotation and they can see it coming out of the pitcher's hands easier, which is a big, big deal. And all of this can be covered in greater detail in the live seminar. I just wanted to show you this movie and this documentary on Netflix. Will Smith Concussion is a movie about American football players and the long-term effects of untreated concussions on them. And then the other one is The Mind of Aaron Hernandez. I played American football for 11 years. I have several teammates that are on death row out here in the United States because they went crazy and killed people after playing. So it's just one reason why this is a passion of mine to be on here. It's because not only are you helping that athlete to perform better, but you may be changing the course of their life down the road. Now, as we do have a lot of stuff to cover in an hour, so I want to make sure you're aware of this in case you aren't. If you're on Facebook, I have this group, Dr. Gair's Laser Therapy Treatment and Marketing Secrets. This is completely free to all of you. The reason we have almost 2,000 members in there, the reason I created it is to continue the conversation, ask questions in there, especially of things that you saw today in the webinar, and that way you don't have to wait until May to get some answers from me. I can answer you some stuff a lot sooner, and also some of the other doctors who are also great experts in there can also chime in. So let's look at this one study. This really showcases what laser can do for not only concussions, but also think about, like, let's say you have an athlete who comes in who has a concussion from a sport, but they also have a grandparent who's going through Alzheimer's, Parkinson's, any kind of neurodegenerative kind of condition. Well, this study showed that a visible wavelength red laser of a low dose at low wattage could actually help to not only protect the brain from neurodegeneration, but even reverse it and break apart some of these things. And the key thing for your athletes who have concussions, like, take a picture of this slide, and I'll send my slides over to everybody from Australia, and you guys can disseminate to them so you can take a look at this at your leisure. This is really important because when it talks about modulating the microglial cells, those are the immune cells that when you have an impact, they start to attack not only the damaged tissue, but over time, if you get another impact, like in a sport like rugby, or you're heading a ball like in soccer, you can get these repeated concussions that now these glial cells sit in place and chew up healthy tissue and create what's called a honeycomb appearance. What's really cool is the research shows if you take the laser and you put it on a brain that has activated glial cells, it could shift them from an inflammatory state to an anti-inflammatory state. And you can try to help prevent those cells from attacking healthy nerve tissue. And this is one that we'll cover more detail in the live seminar. The main takeaway I want you to see here is that worldwide, cases of Alzheimer's and dementia and Parkinson's are becoming more and more prevalent. So by you getting lasers on these young athletes' brains, whether they're kids, teenagers, or college or professional athletes, you're not only helping enhance their performance, but you're also helping to prevent them from going down the road of neurodegeneration. And for an example, this is an Erconia study on Parkinson's that showed that when patients did nothing else but just had the laser applied to their brain, they had less trouble with their gait, they had less freezing, better cognitive functioning, and less difficulty with speech. So really, really important things, especially because Parkinson's actually starts in your 20s and 30s, and it can start with loss of smell or chronic constipation. So you can be helping enhance these younger people's function and preventing them from going down this kind of a pathway later in life. What I want to show you here is a really cool slide that happened by chance when I was at the Life West Chiropractic College up in Northern California for their event called The Wave. And this is a quantitative EEG that one of the doctors who's in the administration of the school came over and he told us, hey, I had a stroke. I want to do the lasers on my brain and see if they have any impact. So he told us he had some deficits in his speech centers. He didn't tell us he had done this WAVI QEEG scan. But so he does a 10-minute FX session, and he goes back over to the WAVI. You see session 1 and session 2. They're a little over an hour apart. He did his first session on the left there. You can see it shows that that blue area and where the X is, that's where his stroke lesion was. That's near his speech centers in his brain. He didn't have good activity. When you see session 2, you see all of a sudden, bam, it's not so bad anymore. That normal activity, which is the red and the yellow, is taking over a bigger chunk of it. And the doctor who ran that quantitative EEG, he didn't want to run the second session on him at first because he said there's no way there's any change in just an hour. And the doctor who was the experiment who got under the FX with us, he said, well, just humor me. Let me just see what happened during this past hour. And when the doctor running the QEG saw this, he said, what the heck did you do? This normally doesn't occur unless you've done about 3 months of therapy. We did that in a 10-minute FX session. So I like starting with this so that gives you an idea to make things easy. If you just put a laser on the brain, have your athlete go through balance or eye exercises, you will enhance their function that easily. So I've done this with different athletes here. Like this is a kid, Justin Didich. He started with me when he was a 12-year-old normal-sized human being. He then was a star offensive lineman in American football here at University of Southern California. He's now with the Los Angeles Rams. And then I've worked with other kids in baseball, some who are in the pros, some who are in top tier colleges. And these all would come into me for an injury. It's very easy to enhance the injuries. We'll get into that here just shortly. We'll enhance the recovery between 30 to 70%. But most of these kids and athletes then stick around because they like the enhanced performance as well. So I'll give you an example here with this kid. This is Zach Shinnick. And Zach Shinnick ended up setting a world record in the Pan Am Games in 2017, but they did not expect that to happen because during that, just before that event was to take place, he came into my office with chronic hamstring pulls. Now, he'd been to top physical therapists. He had great chiropractors to adjust him, but this kid's hamstring kept blowing out all the time, year after year. So they asked me if I could help him. So one of the things I showed him that we did, and we'll do this as a demo in the live workshop that we do in May, is it's very simple. I had him lay down his back, and I would just test his myotomes. Remember Hoppenfeld myotomes, for like the quads, the hamstrings, the hip flexors, the glutes. I would go through, I'd test it, and if something was weak, then I would just apply the laser to that muscle for about 5 or 20 seconds. What's really cool is I can stimulate the muscle to fire better and to activate. And so we could go through and find these muscles that were inhibited, and we could turn them back on with a laser. And what we did with Zach was we got him not only back to racing, but we got him to winning championships. Because one of the things I tested Zach on, and I encourage you to try this yourself, is to stand up, put your feet together, and close your eyes and see if you wobble. Now, this kid was an elite athlete, one of the tops in high school in 2017. When he closed his eyes, he was wobbling all over the place. And if I tried to put him into a heel to toe standing position, even with eyes open, he was all over the place. So guess what I did to enhance his performance? I had him stand, close his eyes, arms together, and I would laser over the back of the head. Now, if you've got the handheld, you can put it in a stand to do that, or you can stand there and hold it. If you've got the FX, it'll telescope up and be around that area. And we did balance exercises. We stuck him on a vibration plate while we did the laser. And with doing that, we got him back to where he ran faster than he'd ever run before. And he sets that world record too. And without the laser, none of that happens. So without making this very complicated, a very easy way to do this with a runner is you can also have them stand up, laser them while they go through different phases of running, of gait. And that's going to help to reset and recalibrate those pathways. So you can use this laser stacked with whatever kind of active exercises you might do. Also, you can stack it with passive modalities like electric muscle stem or soft wave or decompression tables. Any of that stuff will work. The key thing is with Zach is if we didn't use the lasers and we just did the great things of adjusting him and doing therapies, he would have blown out that hamstring again. But why he was blowing out is this. When he closed his eyes and his balance was all over, that told us his brain didn't know where he was in space. So his hamstrings had to work harder to balance him out. So when we corrected with the laser on the brain while he did balance, he didn't have that hamstring problem anymore. And he went 4 years without another problem. Now, for treating athletes, I want you to please take a picture or a screenshot of this slide because this is a very important one. This is the one that I'll give to my athletes when they come in, and I'll ask them, hey, would you like an unfair advantage over your competitors? And what athlete wouldn't like that, especially if it's legal and doesn't harm them? This study showed that lasering athletes, either before or after exercise, could increase their time to fatigue, increase their number of repetitions, give them more torque and more muscle mass. And if you did blood tests, it showed decreases in inflammation and oxidative stress. So what I really love about this, and that I tell to my athletes or coaches who are coming in, is I say, look at the bottom here, where they say, we raise the question of whether laser, which is photobiomodulation, should be permitted in athletic competition by international regulatory authorities and the Olympics because it seemed to give the lasered athletes an unfair advantage. So when we hand that out, that's when the athletes want to come in all the time because they see that it has been shown in studies and they feel it themselves too when they're performing. So here's an example of a couple of the protocols. So sample performance enhancement protocol, take a picture of this. Ideally you want them to come in regularly. I like to have them come in the day before a game or a tournament, or if there's anything they're going to be showcased in, and during their active season, I want them in at least once a month, ideally every week. The optimal protocol is to do what's called neurorecalibration, which I'll teach you at the live event in May. My favorite is with the green and violet, but you can do it with any of them, but I find the best results with the green and violet. So you'll go through and you'll test the muscle, like say the biceps. If it's weak, you laser it till it strengthens, and then you go and you test the triceps. Then you laser till it strengthens. You can do the front deltoid. If it's weak, laser the deltoid till it strengthens, and then move on to whatever muscles you want to test. That's what we're going to workshop. It's one of the things we'll workshop then. So I start with that. Then I place them under the FX, either stacked with a GVL on the brain, or I can lie them down and have it hit the brain and the abdomen and also the legs. We'll spread it out over there. Now you can also have them seated and perform eye movements or use a vision app or a vibration plate. But the basic protocol is just to stand them, put the laser in the stand, and let the laser do the magic. Don't overthink it. What I find most doctors do is they overthink it, make it too complicated. You let the laser do the work. Now, why are we talking a lot about sports medicine? Well, here's one reason. It's predicted to reach 8.1 billion in US dollars by 2027. So it's growing a lot. I've had the privilege by working with athletes out here in California in the United States to be invited to work the Dodgers and Angels fantasy camp. And I got invited out to work with the Los Angeles Lakers to demonstrate this to their training staff. The reason why they wanted me to demo this is they're having trouble with a lot of injuries. So I get to come out there and I see one of my idols growing up. This is Kurt Rambis, who played professional basketball for the Lakers when they won a lot of their championships in the 80s. But here's the main thing: is this is Bethany. She's the wife of the strength trainer for the LA Lakers. And the strength coach that I worked on him, he didn't have any pain. And this is a cool thing. So he's in there and he has no pain. So I said, okay, what thing you have problems with? So find out what they have difficulty. And he said, well, if I try to do my max squat, I do have pain in my, it's about a 4 or 5, but it prevents me from going heavy. So I said, okay, cool. We're going to do the laser on you. And then you go and you test it tonight and then call me and let you know how you did. So I went through and tested each of the muscles that I'll show you in the live workshop. You could also just have him lay on his back and just do leg movements, because the laser works best when you activate tissue. You can have him do little knee extensions or little like walking in place while you laser. So I had him do this. He went home that night and he did the squats, and he called me. He said, dude, that was amazing. I had no pain and I was able to squat heavy again. I talked with Rambis, the coach from the VP of basketball operations. He said he wants us to guinea pig my wife. This is his wife. He said his wife had chronic pain since she was 12 when she was a gymnast. She was now 30, and she's a famous CrossFit athlete. She was unable to compete in the world championships the year before I met her. And so we wanted to guinea pig her and see what we could do with just passively utilizing the laser. So here's what we did on her is we had her come in, and we're about 8 weeks out from her competing in the CrossFit championships last year. And remember, she had an 8 out of 10 every day. She said if she could get it down to a 7, she'd be ecstatic. What we did is we had her come in once a week. She'd be under the FX, which is the big one that looks like R2D2, put on a back pain protocol for 20 minutes. Didn't touch her, no adjustment, nothing else on her at all but the laser. She took home the green and violet to utilize at home on a daily basis. So we did this as a rental. We charge $250 a week as a rental. So she took it home and she used this. She said within 8 weeks, she went from an 8 out of 10 to a 0 out of 10 pain-wise. This is really important because she'd never been out of pain since she was 12 years old. She'd been to chiropractors, osteopaths, physical therapist, had a red light therapy device. None of that helped like this did. And she ended up finishing 14th in the world that year. So this year we tested her out of doing another round, another 8 weeks of doing the home rental. This time she finished #1 in the United States and 4th in the world. Now, the one reason I mention this is because she's going to start doing promotions for Erconia lasers on social media. So that means that there's people around the globe, as CrossFit grows, are going to be looking for people who have these lasers that she used to do so well. Here's a sample protocol, though, for the office with chronic low back pain, whether it's an athlete or whether it's just an average person with back pain. I like to stack the FX and the green and violet together. I'll do 7 to 20 minute treatment time unattended. At home, if they're doing a rental, we'll have them laser 2 to 3 times a day for 10 to 20 minutes, and they could go for an hour. You're not going to you're not going to create any heating damage with these lasers, but particularly, let's say for performance enhancement. I had several athletes last week who got injured in playoff games, and they came in injured on a Monday and had a game to play on a Friday. So what I did with them is I rented them a laser for $250 and had them apply it, like let's say to their sprained ankle, 3 or 4 times a day, so they can get healed and back ready for the game on the weekend. And we'll have people rent those like that all the time, or you can have them come into the office every day to get back out there faster and also enhance their performance. So before we get into more stuff, key concept I want you to understand is that when we're talking about these lasers and their colors, their wavelengths, is that there's 3 different groups of what they're best at. Now, there's overlap between lasers, like they're all good for knocking down inflammation. They all can produce stem cells, but some are better than others. So take a picture of this. If you understand nothing else from this seminar, but this is a great one. The violet wavelength has the highest energy. That's the best for antimicrobial support. So that has clearances from our American FDA for bacteria and for fungus. It's also great for scar tissue breakdown. If you got that athlete who had an old surgery or chronically tight traps or some really gnarly scar tissue you can feel, that one, because of the high energy, can break down the scar tissue faster, especially if you stack it with your hand tools or whatever devices you use to try to break apart scar tissue. It will help support vascular endothelial growth factor, which helps to repair blood vessels. And it's great for sympathetic and parasympathetic balance. Now, the green is the best for collagen and elastin support. So you can see that's why a lot of Dermatologists use it for anti-aging techniques. It's great on chondrocytes, so there are studies showing it being able to stimulate the repair of chondrocytes. It has the biggest impact on stem cells. And remember, stem cells become new tissue of any kind. It's also showing to be superior for bone and nerve regeneration. Now, any of these wavelengths can help with bone and nerve regeneration, but green is the best for that one. When we look at red, it's the best for the final step in the energy chain, or remember in the electron transport chain, you got 4 steps, complex 1, 2, 3, and 4. And the red helps the 4th one, green helps the 3rd, violet helps the first 2. This also helps support interleukin 10 and cell proliferation, and it decreases prostaglandin E2. So it's anti-inflammatory. So big things with that. So let's look at, what about you got an athlete, or let's say, and this will apply for also, this is a great thing. You don't have to learn a bunch of different protocols for different conditions. Think about the big picture. If I'm trying to enhance an athlete's sports vision, or a kid with a reading disability, or an elderly person who's having trouble reading and focusing, I'm going to use similar types of things as I would for sports vision enhancement. So one of the things that we're going to do, like in the live workshop, we're going to go through and I'm going to show you some muscle testing while we go into different areas of vision and resetting each specific area, which is really cool. We don't have time to do that right now in this webinar. So I'm going to show you the basic one. The basic one is, all you have to do is basically go down to step 4, is that you can just put the laser on them and have them track your finger. What you want to watch for is, do you see the eyes go click, 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 click? If you hold it up here, do they have trouble holding it? You bring it across, do they jump past it or fall behind? And point it out to them and their family member. And you'll see, as you have them doing the cardinal fields of gaze, that it starts getting easier over time and they can track better. And then their test is, if it's a sport like baseball, when they go bat. If it's basketball or soccer, hey, how's your field of vision? If it's reading, you have them try to read, and they'll usually see that it's easier afterwards. So this is where you can also stimulate, go to peripheral vision and come over here and come to the side and say, tell me where you can see it, and then keep working that for them to look straight ahead and focus on seeing this over here. And same thing, focus on seeing it while they're looking straight ahead and a laser's applied. It's that simple. Just whatever you want to enhance, you do it while they're under the laser. That's really that simple. And again, we'll get you into workshops and show you that little extra wrinkle of the muscle test on that really blows patients' minds, and it does make it more effective on the patient. But this is a great start. Same thing with gait and running speed enhancement. So what I really like to do with gait and running speed enhancement is, this is where I'll go through and I'll test the muscle. I'll test the myotome, like what we learned in school for standard muscle testing is test the muscle. If it's weak, laser either over the muscle belly or the nerve root for 5 to 20 seconds, and it should activate if it's not a major thing like a tear. And you can go through each muscle in the legs or the upper extremities. Again, we'll workshop that live in May. But let's look at this for running enhancement. What you can do here is you can have them, like in the workshop, I'll have you show going through each phase of gait and testing it and resetting that one. But the easiest way for you to do this is just have the laser on them and have them just go through a little mock walking, exaggerated walking, where they're really moving their hands and their lower body, the opposite leg with the opposite arm, just going and walking like this. You can go behind them and then have them do it in place. What you find is a lot of people will do, where they bring up the right arm, they bring up the right leg, because everything's switched up in them neurologically. So you may have to put them in a position with the right arm forward, left arm back, right leg up, left leg up and the right leg down, and laser them while they just go back and forth like they're some kind of marionette or a marching soldier. And that's an easy thing you do while they're going through it. It'll make their running smoother and you can enhance their speed. Again, I'll show you some extra cool little tweaks to that in the live seminar. So laser rentals, if you haven't thought about that, again, I don't know what your rules are in Australia, so they'll talk to you about that. But I do laser rentals, and what I do is I'll charge $200 per week for my Accelerate and $250 for my red and violet combos. I don't rent out the green and violet because I only have one on there. But so we do it where patients rent for 3 weeks, they get 1 week for free. So we get a nice passive income, especially when I'm off on vacation. So that's to understand there. Now, what I want to get in here is to show you the studies that support what I've shown you to do. You should be able to see how this is very easy. Get a laser on the brain or on the body, have them do some activity, you will enhance performance, as simple as that. Treatment times are usually between 5 to 20 minutes. I find younger kids don't need as much time as older, athletes that are in their 50s or 60s usually need some longer time. So when we look at, let's say though, this athlete is coming in with chronic low back pain. This is a study that shows what you can expect as far as results. And I'm bringing this up because this is showing you the differences between true laser and a red light therapy device, because there's a lot of people talking on the internet about, oh, red light therapy, it's the greatest thing. And a lot of times they'll reference laser studies like our Erconia studies and say that red light therapy is the same. But we have double and quadruple blind studies that are placebo controlled that show that it's not. So this was taking patients who had chronic low back pain, minimum of 5 years duration at a 5 out of 10 of pain, and we applied the laser twice a week for 4 weeks for 20 minutes. The straight line is the laser group, and you see that at the end point, the laser group outperformed the dotted line, which is the LED group. But where the big difference in my mind is that post-treatment, the laser group patients continue to get better, whereas the red light therapy group, their stuff started to come back. And that's what we tend to see when we did clinical trials on neck and shoulder pain, chronic heel pain, and plantar fasciitis. And what was really cool is we did a follow-up 12 months after the patients were done with their trials, and we found that on average, they improved another 17.46%, which is a pretty huge improvement there. And we see this, these are the studies you can look at later. I just kind of summarized it for you. We did the same thing with chronic heel pain. So we know a lot of athletes can have plantar fasciitis be a big problem for their careers, especially if they're playing, soccer, or they're playing rugby or American football or international football. Any of these things, this can greatly, or basketball, can greatly affect an athlete's function. This is showing on average that patients would do 6 10-minute sessions is what they would do. So twice a week for 3 weeks. And you can see the dramatic drop in there on their visual analog scale. And then once it was done, you see even 6 months post, they kept getting better, and a year post, they continue to get better. So this saves the athlete from going in and having to have a surgery. What about if it's not an athlete, but if you've got somebody who's a performer, a singer? So Bon Jovi, internationally famous. I highly recommend you take a look at their documentary on Hulu, because 22 minutes into that documentary, John Bon Jovi is showing himself utilizing the FX 405, the combination red and violet, over his vocal cords, because he said he doesn't want to be the fat Elvis performing longer than he should. He doesn't want to do anything to tarnish the legacy. He wants to stay in peak performance. He says that the laser helps keep him in tip-top shape. So he will do his vocal exercises and do the laser. Now, what I would do differently is, if you do watch that documentary, I would have him do the vocal exercises while he lasers, because that's where you're going to get a bigger impact, is if you do it at the same time. How do you do it? These are the same kind of settings. You can put the laser on the brain, over the front of the neck, and then use these basic settings I have there. 1, 10, 40, and 60 is a catch-all for any kind of brain enhancement. 4, 9, 33, and 60 is any nerve enhancement. 9, 16, 42, and 53 are basic catch-all protocols for anything you're not sure about. You can always default to that. All I do with the singers is I place the laser either in front here or in the back of the neck, and we have them do vocal exercises. We have them do scales. So just like I would an athlete going through their specific motion, with a singer, I'll have them do that. If it's a guitarist who's having trouble, I have a guitarist who's like that, who's professional. He's having trouble with his fingers playing guitar. So guess what we do? We put the laser on him while he does guitar exercises and then plays a song he hasn't been able to play well. And we just enhanced his performance and got him back up to a better level. So let's look at, if I'm trying to enhance a person the most, this is where I was one of the principal investigators on the green and violet. And this is really cool because our study got accepted through peer review, which whatever laser you're looking at, always take a look to see if they have peer-reviewed studies on there, because most don't. Only 12% of submissions are accepted, and we're assessing the impact of high photon energy wavelengths. That's a key thing. That's what we use in Erconia. Is this not high power, not high wattage, but high photon energy? We're using these energetic emissions from those green, violet, and red lasers to make some bigger changes. And we got immediate results that lasted long-term. What I want to really show you is this. This summarizes it for you. This is comparing a red laser only versus red and violet versus green and violet versus the LED, which is red light therapy. So we had the duration of pain was almost the same for all of them. We needed to get at least a 30% pain reduction for our American FDA to consider it effective. With the red, we got 65%, red and violet was 75%, green and violet 81%, surpassed 30% pain reduction, and in red light therapy, it was only 11%. That's not enough to be considered successful. Now, if you look at the percentage improvement in pain from right before we did the assessment to right after we did a 12-minute treatment or 13-minute treatment, it was roughly the same, 48, 45, 52 for the lasers, but only 8% for the LED. Where you see the big difference in which color or wavelength you select for the laser is the long-term benefits. The percentage improvement in pain from the study endpoint to 40 hours post-treatment for the red was 43%. For red and violet, it was 50%. And for green and violet, it was 65%. For the LED group, it was 0. Whatever small improvement they got, that 8%, by the time the 48 hours came, it was gone. Percentage improvement in range of motion was greatest with green and violet at 32%. Red was 14. Red light therapy was only 2%. So I want you to understand that slide because you have a lot of people misrepresenting that a cheap LED red light unit is just as good as a laser. And in this placebo-controlled, double-blinded study, you can clearly see that that is not the case. Now, what about if you got an athlete who has multiple tears on an MRI? So I've done that many times, but this is a guy who is a worker who he lifts heavy refrigeration units. He had a full thickness tear of the supraspinatus tendon and had mild retraction. That's a key thing there. If you see an MRI and there's mild retraction, you can many times heal that with the laser without surgery. He also had a full thickness tear of the infraspinatus tendon and a possible tear or probable of the biceps. So here's what we did for this simple shoulder protocol. I'll show you the optimal when you come out live in May in Australia. That's where we're going to test the affected muscles. If it's weak, we laser to strengthen it up. Then we just surround the area with a laser. And a key thing is this. You take the laser, whether it's a handheld or if it's the FX, and just have the patient move in the range of motion that doesn't increase the pain. Any of these settings I put in there, take a screenshot of that. Any of those settings can work for this. The 8, 25, 42, and 125, or with 279 at the end, or the basic 9, 16, 42, 53, or one that I really love here, the last one, it's the ligament setting, 5, 9, 125, and 27, 20. Find a lot of people heal really, really nicely with those ones. So it's as simple as that. You can do the advanced protocol I'll teach you in May, or you can just stick the laser in there, have them move it where it doesn't increase pain. What you'll see with that individual, let me go back here, despite having those complete tears, he never had to have surgery. We did the laser. His orthopedic doctor stacked it with PRP after a month of laser because 1 month later, he went from here to being able to raise his hand over a head. He did have severe pain, but he could do the motion. So then we stacked the laser and the PRP, got him back to full motion within just a few months, never had surgery, got to go all the way up till the day he retired with never having the shoulder pain. And that doesn't happen without lasers. Now let's do one that really applies to athletes. Let's say you got an athlete who's had an injury where they're going to need a surgery. They're going to need a surgery and they're frustrated because like, okay, great, my whole year's gone. That's what happened to this girl. This is Brianna, beautiful girl, inside and out, sweet, sweet girl. She's a wrestler and she is amazing on the mat. You see these videos of her and she's just a beast out there. Well, in a championship match, another girl hooked her leg and swept it, and you can hear it pop, pop, like branches breaking from a tree. And she suffered a terrible triad injury where it was her meniscus, her MCL, and her ACL were gone. Her orthopedic doctor said, you're going to have to do surgery on this. You'll be out for a year. You can forget about your senior year. So what did we do on her? We did a pre-surgical protocol. So this is where if you got an athlete or anybody who needs to go in for surgery, have them come in pre-surgical at least 2 times a week for at least 1 week. You can do more, that's better. There's the basic settings you put on, which are acute injury settings. And I like to do at least 5 to 6 minutes. If I can go for 10, that's better. Optimally, I like to rent lasers out to patients who are going to go in for surgery because then they can do it multiple times a day. So we did that for a couple of weeks. The goal there is to stimulate stem cell production, which becomes new healthy cells. We want to increase glutathione. That's a great antioxidant. Increase nitric oxide for better blood flow. Increase ATP, etc. And then utilizing violet that minimizes the chance for infections as well. So that was our phase 1. Phase 2 was where we had her just come in. We put the laser on her and have her do little movements to her tolerance. Little movements back there. And you can see each session is getting a little bigger. The laser also helped the surgical incision heal faster. And then this is where I say the sample surgical protocol with the rentals. We have them do that then, what I just showed you, at home. I tell them as soon as you get home, get that laser out, put it on the shoulder you had surgery on or on the knee, and do whatever small movements you can. I'm talking even if it's just real small like this, even if it's just moving the hand that's way down here or moving the feet. We want to get those neurons to fire because when we do that, they're more effective in resetting the way the brain is trying to retrain itself. So our phase 3 would be then coming into the office, and that's where I'll test each muscle to see what's weak and strengthen up. And What I'm going to show you in the live event, the workshops in May, is a really cool technique where if you have a scar, let's say for an old injury, I'm going to show you how you can tug that in different directions while we laser to reset that scar, which many times will instantaneously improve that person's range of motion and dampen their pain. It's too much to show right now in a webinar, but in a live event, it's really, really cool to do. So here we go. Let's talk about what about fractures. If you have an athlete who has a fracture, this will also heal up a lot faster. You see, there's the 2-week follow-up over here. There's day one on the left. This was a patient who's a brittle diabetic. You see, it's still enhanced the repair. What do you do in this case? It's simple. You just stick the laser on there. These are great rental cases as well too. We'll put the laser just above where the cast is. We'll try to get it near the large arteries and blood vessels, and that will get the energy to stimulate the osteoblast production. Here is showing you that person's foot just 2 hours apart, where you see on the left side is the fresh fracture. Right side is 2 hours after doing laser. So you can instantly see the swelling come down. This is where I have an athlete, and I've had this before, where an athlete will roll their ankle and they think they're going to miss the next week. We'll get the laser on there, get their ankle return to normal size, and get them back out there playing at least 30% to 70% faster. And this is just showing you, this is one of my patients who was a basketball player, point guard, who fractured his ankle. He was told by one of the doctors with the LA Lakers, who said, hey, you're going to miss 9 to 12 weeks or 8 to 12 weeks, which that's most of his season. We did the laser on him and got him back in just 5 weeks. The huge thing about that is by getting him back sooner, and then we enhance his performance afterwards by lasering the brain so he could shoot better, is that kid in his final game of his last year in high school became his team's all-time leading scorer, and he managed to secure a full ride scholarship to a university here in California. And for your reference, here's a study that shows laser working on the bone. Key thing for you to understand here, any wavelength will work, infrared, red, green, or violet. But this study from Scientific Reports said that green and violet were more effective in osteoblast development. So these great rental cases. Another one for sports. This is my patient who is a college softball coach, and she took a 70-mile-an-hour line drive into her shin. On the left there, you see, she said it actually looked worse than that. You see the skin is all peeled back. They thought they might have to do a skin graft. On the right at the top, that's the same lesion at the top. We did 2 times a week with a combination of the red-violet combo. I didn't have a green yet, so we did the red-violet. Excuse me. And we did the FX for 7 minutes. Now, down there at the bottom, you see another lesion. That's because, like, literally a week after she had us treating the first lesion, she took another line drive to the leg. So this is one where if we don't do this, she's going to be bandaged for a long time. She's going to not be able to be out there coaching, and she might need a skin graft, and then she might have long-term problems. With this, she has no long-term problems at all. So as I'm getting close to the end here, I want to go over a few things. I've been using lasers for 20 years, since 2004. And this is a much better time to get into them than 2004. And there's a few reasons. One is just the fact that we're able to do these trainings via webinar now. When I did it in 2004, you had to physically go to a seminar and sit there and learn from somebody. And there weren't that many that year. So it's very hard to learn. That's why I created these webinars. That's why I created the group that I showed you earlier. So I want to make sure you guys don't struggle like I did. But here's something to think about. When we look at lasers, the market is growing a lot. We didn't have time to cover the Zerona lasers, which are for fat loss. But we're seeing this in aesthetics, that fat loss lasers are blowing up. They're getting really, really big. They're projected to continue to grow to 2029. And if we look at this global laser therapy market, it's grown from 3.11 billion to projected to grow to 4.39 billion globally. So everywhere starting to catch on to this stuff. And one way you can tell is by looking at what are people searching for online. We look in the last year, that photobiomodulation searches had increased by 23%, which is photobiomodulation. It's a catch-all phrase for lasers and light therapy. We look at red light therapy, searches for that have grown 81%, which is a huge growth. And we look at, like, people are talking about red light therapy, but it's really old tech. The Russians have been using that as standard medical care since 1974. Dr. Murphy, who trained me, had been using it since the 1980s. I'd been using red since 2004. Green and violet are the cutting edge, especially the GVL that we have here that I was one of the main researchers on. It's the most advanced, highest energy handheld laser right now in the world to have these clinical studies supporting it that are peer reviewed. And here's the key thing I want you to understand. is that if you're an early adopter of new technology like the green and violet, you get some different advantages. And this shows you, like right now, to utilize green and violet, you'd be in the innovator group, which is 2.5% of people. Anytime you do that, you get a market advantage over all your competitors because you're seen as the one with the newest and shiniest toys on the block and become the experts on there too. In the United States, less than 25% of chiropractors use red or infrared lasers, even if you use violet or green. So you'll be the first one with this tech if you decide to add it in there. And no, you won't have any competition for a long time either. So what I want to kind of leave you with here is a few things of what happens when lasers applied to the body. So you understand this is that a big thing here is that you can look at this slide later, but if a patient has like autoimmune thyroid conditions, the lasers have been shown to be able to calm down those antibodies for thyroid and for other autoimmunities. And I'm not saying you treat them with this. You're not treating them, but that's a nice side effect. Someone's in your office for sports performance enhancement or for an injury or for a surgery they're trying to recover from. Well, guess what? You also may help their thyroid. You may also impact their blood sugar levels. You're going to support the powerful antioxidant glutathione. You're going to improve vascularization. You're going to stimulate stem cells for the liver, for the pancreas, for all these different organs in the body. You're going to stimulate heat shock proteins. A lot of cool things that happen. And it happens globally, like the production of stem cells. It's the biggest with the green, but any of these wavelengths will have an impact on stem cells. But green is the biggest one on that. You'll get brain-derived neurotrophic factor, which is like fertilizer for the brain. It's anti-inflammatory. And think about inflammation. What is inflammation involved with? It's with everything from cancers to diabetes to death. So if you can knock down inflammation with these lasers, particularly if you're using 3 wavelengths, you can get a huge impact on the patient's overall health. As I mentioned before, the violet is the biggest one. That's antimicrobial, antiviral, antifungal. It does this not like an antibiotic where it comes in and blows everything up. It's supporting the immune system to fight against different things. And again, talked about this earlier, the difference in wavelengths. There's certain things you can do on the left under the UV that you can't do on the right under the infrared, and vice versa. Things you can do you can't do under the infrared that you can under the ultraviolet. Easy example is if a baby is born jaundiced, it will put the baby under blue light, and that helps to correct the problem with bilirubin. So it's really, really easy to understand. What I want to leave you with here is I'm going to skip quickly through a few slides because we only have a few minutes. What I want to show you is this. These lasers impact the mitochondria. If we can impact the mitochondria, we can help these conditions because these conditions are caused by dysfunctional mitochondria. Skeletal muscle and movement disorders, metabolic disorders and diabetes, cancers, cardiac diseases, neurodegenerative, pulmonary, vascular, aging, dystrophies, renal dystrophies, neurological disorders, and autism. So when we get these red, violet, and green lasers on the body that support the mitochondria, if damaged mitochondria are part of the problem in these conditions, we can thereby help provide support for those conditions with these lasers. And to get an idea if your patients may have dysfunctional mitochondria, look at their history. Are they taking any of these? NSAIDs, aspirin, indomethacin, diclofenac, piroxicam, or ibuprofen? That will disrupt mitochondrial function. If they have long COVID, that will disrupt it. If they're on these meds like Lipitor, metformin, which are common in the United States, hydrocodone, even aspirin or metoprolol, these will disrupt mitochondrial function, and the violet wavelength can help with these ones. We'll get into deeper detail in the live event. This is something you can look at that shows you medications and the conditions they can do by disrupting mitochondrial function. I want you to see this here. This is an important one for you to understand, and then I'll turn it back over to you guys over there. Chanel, I'll turn it over to you in just a moment. Ask yourself this: how many of your patients are exposed to these things? Glyphosate or Roundup. Here in the United States, they put that on almost everything. That's going to shut down complexes 1 and 2, which the violet supports. Artificial sweeteners or colorings and dyes, that's in everything out here in the United States. I don't know how it is in Australia, but we see this, junk foods are bad worldwide. This will knock down the first 3 steps in the electron transport chain. I call it the unholy trinity of junk. High fructose corn syrup, pesticides and herbicides, vaping or smoking, hydrogenated vegetable oils, COVID spike protein, alcohol, all these things can disrupt the body to make energy by disrupting the electron transport chain by affecting complexes 1, 2, and 3. Those are key things that I really want you guys to understand here and to see how we've got studies showing how these lasers can impact things in addition to sports performance. Like here, this is showing red, violet, and green helping patients with renal fibrosis to actually repair the tissue in there and break down the fibrotic tissue. This is showing the red, violet, and green actually repairing matrix modifying enzymes. Repairing the discs in the lumbar spine by stimulating extracellular matrix modifying enzymes. So we got all these different things that are occurring on here when the laser is applied, even though there's not direct penetration on there. So, Sherelle, are you ready to pull it back to take it over and look at what questions we have?
Thank you, Kirk. I
Sure.
do know that you have mentioned repeatedly about the event, so I'll just quickly show this slide to everyone. I'm actually quite excited just having you for 1 hour. So much information already, so I can just imagine having you
Thanks.
to ourselves for that 2 days. On May 24th and 25th in Gold Coast, we used to have this in 2 different states, but for next year, we're only running it in Gold Coast for the 2 days. So there's really limited seats available. To secure your seats, please visit our website at rehacare.com.au/events. And luckily enough, we've heard a lot from Kirk. I can see in the session that we also have Brett logged in. So Brett, quickly tell everyone here on what you will be delivering for the session in May.
As Kirk sort of alluded to, and the topic here, enhancing with patient outcomes, like you got our sports performance aspect, brain performance. So a lot of the stuff that Kirk just alluded to is really what we're going to be trying from both of us to try and get across to the attendees, the hands-on aspects. I'll have a little bit more of a bias from my side of it, with obviously the head injury, sports-related concussion aspects, with tying into that sort of neuro-orthopedic rehab world. So we'll be sort of ham and egging, dovetailing off of each other. But wherever I can, when we've got someone like Trevor Berry the last couple of years, and now with obviously Kirk coming out, I really want to try and give as much of the platform as I can to those guys, because here in Australia, being so far away from the rest of the world, when we get an opportunity to have experts and people with the experiences such as Kirk, I want to have the Australian people have the ability to hear and have more of their time for the attendees. So really, it'll be a bit more of a Kirk show. I'll be there trying to help support wherever I can, throw in a few little things, as we said, sport-related concussion, neuro-orthopedic rehab components. But yeah, I'm really looking forward to this one, just because of I get a bit more of the performance-based focus.
Thanks, Brett.
Awesome.
You've heard it, folks. It's going to be an immersive hands-on workshop